Hi, welcome to my channel. Today I'm going to show you the full procedure of a hair transplant and the same patient's hair transplant result, which you've never seen before on the internet. So this young 28-year-old Indian male walked into my clinic 7 months back seeking a hair transplant surgery for his grade 4 male pattern baldness. And today in May, 7 months after the procedure, I showcase to you his entire hair transplant procedure and the result that has evolved. He has been on medication, quite compliant with medication. So hang on and watch the full procedure, followed by a discussion on his result. A little bit about my clinic. When you walk into Dr Bhatti's clinic, you should be reassured of the fact that we do only one case in a day. The doctor who sees you is the doctor who treats you. We may have 2 clinics, but they do not operate simultaneously. 2 clinics, one in Chandigarh and the other one in Mumbai. We offer top-class, world-quality hair transplant procedures that are safe and effective. Since I do all the surgical steps myself, we do only one case in a day. And we live by the motto, one doctor, one patient, and one clinic. So come to us and get the Darling Buds experience. So after hairline design, after temple point design, and taking the approval of the patient, so we are on the same page, we proceed to do the trimming, to clean the scalp with antiseptic solution. The patient is taken into the operation theatre. Local anesthesia is prepared. Patient is placed in the prone position. Marking is done of the entire donor area, the permanent zone of the scalp donor, and the patient is given local anesthesia, which comprises lidocaine with epinephrine. After waiting for about 10 minutes for the ring block to act, harvesting is started in the ratio of 1:5. In our technique, the in vivo preservation technique, we believe that out-of-body ischemia time should be lessened. To decrease the out-of-body ischemia time, we have developed our in vivo preservation technique over the last 12 years. All the grafts are picked only once the entire scalp donor is harvested and not before. This way, the grafts continue to maintain their nutrition from the scalp donor blood supply because they are not completely detached at the base. The punch is cylindrical. The base continues to have blood supply from the scalp vessels and thereby nourishing the grafts, which are picked up once the entire harvesting procedure is over. Once the grafts are picked up, they are put in a nourishing solution which contains, besides PRP, A cell solution and mixture X, which we have over the years developed. It helps in better growth of the grafts after the hair transplant once they are back into the recipient area. And now once all the grafts are taken, we give the patient a break of about 15 to 20 minutes. After this, I proceed to do the anesthesia, the local anesthesia along the hairline, ring block followed by field block using lidocaine with epinephrine. And then I proceed to make the slits using the sapphire blade. The sapphire blade helps in minimizing slit trauma and better results, less telltale signs of surgery, decreasing the chances of a pluggy look, cobblestoning along the hairline, which can occur even with the best of technique in those patients who are prone to develop hypertrophic scarring and even keloid formation. The slits are made in the density of 55 per centimeter square. This, when placed in a particular fashion, closely mimics the density of nature. It is reiterated that the leading 2 or 3 edges of the hairline, the transition zone, should contain only singles, and these single grafts are obtained by carefully dissecting the grafts under high magnification. There is a way of making slits along the temple points, making slits safely without causing any damage to the branch of the facial nerve, which is crucial. The time taken for harvesting 3000 grafts, as in this case, is about 1 hour and 20 minutes. making takes about half an hour, and the plantation, which now follows, will take about 1.5 to 2 hours. Once the plantation is complete, the patient rests in the clinic for about an hour before he goes away after we give him the medications for the night, only to return the next morning for a cleanup, adjusting loose grafts, and for removal of all the bandages that were there. So this is the procedure. This is a routine procedure. There is no change in the procedure. All the harvesting, all the slit making, the essential 2 surgical steps of the procedure are done by me, and the remaining is done by a team, which is an efficient team, been with me for last 7 to 10 years. And this is the way we produce natural looking, dense hair transplant results that last for a long time, along with hair loss treatment for men and women. So this is the patient after 7 months of his procedure. The patient has been religiously taking tablet finasteride, oral finasteride, in the dosage of 1 milligram at night, with no breaks till 7 months till now. And now, since his result has kicked in, I will be advising him to take 15-day breaks every 3 months. Because he's young, I've advised him to continue finasteride for a few more years under supervision. So this is the result, a natural looking result, a result with which the patient is happy. It has altered his self-esteem for the better. Very confident that he will scale new heights in his professional career. The technique that we use is the Anagen Q+ technique, which is one of the many direct hair methods of moving grafts from the donor area into the recipient area, so that you get almost about 100% survival. In our clinic, we follow you up as far as medication is concerned for many, many years, keeping on guiding you, holding your hand as you experience more hair fall, if you do, with what medication is best suited for you in the times to come. And for that, we don't charge anything. If you haven't subscribed yet, please do. Thank you for watching. If you have any questions about hair transplant, about hair loss treatment in men and women, any question about this video, do let me know and I'll be there to help you. Have a nice day and God bless you.